Sleepwalking is a sleep disorder that belongs to the parasomnia family. Such category involves abnormal behaviors, emotions, and perceptions that occur while falling asleep, sleeping, between sleep stages, or during arousal from sleep. It usually involves more than just walking during sleep. It is a series of complex behaviors that are carried out while sleeping, the most obvious of which is walking. Symptoms of this disorder range from simply sitting up in bed and looking around, to walking around the room or house, leaving the house, and even driving long distances. However, the legitimacy of behavior is disputed. Sleepwalking happens during incomplete arousal in non-REM sleep. It is typically seen in the first third of the night, when there is the greatest preponderance of slow-wave sleep, also known as deep sleep. Children tend to have this disorder more frequently than adults. It usually disappears after puberty. It is common for sleepwalking to run in family. Throughout the history, many misconceptions about sleepwalking have been known, such as the fact that the phase of the moon is the cause of it. Nowadays, we know that this is far from truth. In reality, there are various reasons for it to occur: not getting enough sleep, stress and anxiety, infection with a fever, especially in children, drinking too much alcohol before going to sleep, certain types of medication, such as some sedatives and recreational drugs, waking up suddenly from a deep sleep, restless legs syndrome, depression, head injuries, and sleep apnea. With such big list of causes, is sleepwalking actually dangerous? Despite the abnormality of such sleep behavior, occasional sleepwalking episodes don't usually need medical attention, since it's rarely a sign of anything serious and may get better with time. The only problem is inconvenience it causes for those who are around sleepwalkers and for themselves. So how sleepwalking can be treated? Make sure a sleepwalking person is safe and cannot be hurt. The best thing to do is to guide sleepwalker back to bed, as they can fall asleep normally again. Don't be afraid of waking them up. However, if sleepwalker is in situation of potential danger, it is better for them to remain asleep, as it is possible for them to be scared and hurt because of being waken up. Medication is not usually used to treat sleepwalking. However, medicines such as antidepressants are sometimes used if sleepwalking occurs too often, or there is a risk of someone getting seriously injured. These medications may reduce the frequency of sleepwalking episodes, but will not help to get rid of them forever. Apparently, sleepwalking can be prevented. There are many different techniques that can be used for it. As a someone who sleep talks, I tried a couple of them. Some worked, some didn't, but anyways, here's the list of tips that I tested. The first one is trying to go to bed at a similar time each night. Unfortunately, it doesn't work for me, since I cannot monitor the time I fall asleep at. The next one is making sure your bedroom is dark and quiet when you go to sleep. It doesn't work for me either. Despite the fact that my curtains are quite dense, still I sleep talk. The third is to limit drinks before bedtime, particularly those that contain caffeine, and go to the toilet before going to sleep. This is a good one, because it prevents waking up from deep sleep, thus decreases the amount of sleepwalking, or talking in my case, episodes. And finally, finding ways to relax before going to bed, such as having a warm bath, reading, or deep breathing. This absolutely works for me and significantly decreases sleep-talking episodes throughout the night.